Surrey Mental Health and Substance Use Urgent Care Response Centre provides services to individuals who are requiring mental health and substance use services in an urgent manner, but not hospitalization.
One of the things that UCRC did differently is when we started this process of building it, is we ended up connecting with our clients, with our other stakeholders such as our Indigenous population, our South Asian population, physicians, nurses, all sorts of healthcare providers. And we asked them, what does good care look like? And that's what we went off of.
What we heard from everyone was that this service should be therapeutic. It should be a welcoming environment for clients to come and receive service. And so we really put that into place when we thought about designing the Urgent Care Response Centre. So if you look around the centre, you will see that we have comfortable seating, we have a coffee area where people can come and get some coffee and get a little bit of nourishment while they wait for their services. And we have a relaxation space where clients can come in and use if they're feeling particularly anxious before the session. We have weighted blankets for them to use. We have headphones that they can use for noise cancellation or listen to calming music. In addition to this, the other feature that's unique to Urgent Care Response Centre is the group therapy room. We really try to have space where our Indigenous community can come and do smudging. They can hold healing circles here. If you look at the floor, actually, it's very interesting because it represents the four components of the holistic approach for our body, the spiritual component, the physical, the emotional, and mental. We have a fairly large team that is comprised of social workers, clinical counselors, registered psychiatric nurses, healthcare workers, psychiatrists, and of course admin support. In terms of our planning, we really made sure that this would be not only a great place for our clients to receive service, but also a wonderful place for staff to work in. So that's been really part of our philosophy in terms of developing this program.
UCRC is that kind of marriage between both, where you get the fast-paced environment of hospital, but you get the warm, welcoming feeling of the community. And another huge bonus for me was to be working with colleagues of different disciplines, different specialties. So areas that I felt like, I had a lot of learning to still do, I was working with someone who was an expert in that area and who could sit beside me when I'm working with the client and really not just help the client alone, but also enhance my own skills. Huge bonus for me to work here.
We have put into place a lot of support for staff. We have a clinical nurse educator that is on staff. We have clinical coordinators and supervisors who are also available to provide clinical support to staff as needed. And we had an extensive training program as well for staff before they started working here so that they feel confident in providing the service that they will be providing.
Everything that is built into UCRC is infused with that care and passion for the work that we do, and that we provide good care for our clients, and we also provide good support for our staff members.
Well, I think that this is an exciting place for people to work. I really truly believe this because not only that fact that this is a new service, but it's a service that I believe that's really going to support our community.